So the first referral I got from Dr. Winesett was of a 10-week-old, and the 10-week-old's very, very competent mother who was really struggling really significantly with depressed mood, and who was very resistant to wanting to use any medication, and so that provided I think some challenge about, okay, we have a very fussy baby with a very exhausted and depressed mom, and what in the world are we going to do here? And so this was the intervention that was that I noticed in that first assessment, and I was assessing in that case the mom. The mom came in with the baby, and I noticed that the baby was not making eye contact. So at 10 weeks old, the baby was really doing a wonderful job of avoiding eye contact. And I wasn't used to seeing infants respond in that way. And then when I looked at the mom's face through the baby's eyes, I thought, oh, this is a very smart baby, because mom's face looked really scary. And so the very simple intervention in that first session was being able to talk with the mom about the fact that the baby was not turning to mom, and the mom wasn't in any way kind of inviting the interaction with the baby. And so mom and I practiced how she could fake looking warm and loving and kind, and less scary to the baby. And she at first thought this was a little ridiculous, but they came back a week later, and she said that actually she had started really being intentional about this. The baby started making eye contact. They started having this lovely exchange that was a more warm and loving response to each other. And mom actually said that it helped her feel better. And then we also had to marshal troops from the family, grandparents on both sides, and dad came in, and a great aunt came in to also support her, but really making sure that the baby was getting some of that lovely reciprocal eye contact, tenderness, warmth, and caring, and that she was getting lots of support. And that was a 6-week intervention with this family. After 6 weeks, they really, I think, had gotten back on track. And I hear from Dr. Winesett that this child is now a lovely, developing, I think, 6-year-old.
Yeah, I think so.
Yeah.